Good evening, and welcome to Behind the Shadows. My name is Susan Finelli, and I am your host and author of Behind the Shadows, a program where we go behind the shadows of what meets the eye. This evening, we will be going behind the shadows of hoarding. Our guest tonight is Dr. Stephen Brodsky. Dr. Brodsky is a licensed clinical psychologist and psychotherapist practicing in Manhattan and New Jersey. He specializes in treating OCD, hoarding, and panic. Dr. Brodsky has treated numerous cases of hoarding, which has gained increasing public attention, insomuch as we now have reality television shows exploiting hoarders. Dr. Brodsky's clients include individual hoarders, family members, and landlords. Dr. Brodsky has a website, www.ocdhotline.com, where individuals can go online and ask Dr. Brodsky confidential questions and receive confidential replies. Dr. Brodsky, welcome to Behind the Shadows.
Pleasure to be here, Susan.
It is my pleasure to have you here this evening. Why don't we talk a little bit about your practice and the types of patients that come to you?
Sure. Well, I'm a private practitioner. I have offices here in Manhattan, in New Jersey, and also in Rockland County. People who come to me are generally self-referred. They find me online and are very, very self-select group of individuals. Mm-hmm. For the most part, most of the people that see me, and I'm in full-time practice, have OCD mm-hmm. In some form or another. They may also have panic or some other kind of condition related to it, but hoarding is certainly a very large percentage of it. Is
hoarding a product of OCD?
Hoarding is a type of OCD.
It is.
It's actually an anxiety condition where people have have shivers go up their spine about letting go of things and compulsively hold on to them or collect mm-hmm. them and mm-hmm. so forth.
What's the difference between collecting and hoarding?
Well, I think most of us have a little collection of something, whether it's a collection of plates or a collection of, trains or what have you. Mm-hmm. Hoarding, and that's just a hobby and interest. Hoarding mm-hmm. is really an illness, mm-hmm. a mental illness. For various reasons, people become a victim to it for a number of different ways. But basically, it involves collecting or buying or just not throwing out mm-hmm. Objects, possessions of anything from the most trivial, something of trivial importance mm-hmm. To other things that may just have sentimental or symbolic value, mm-hmm. and literally will clutter up their entire home, making it almost impossible to live there comfortably.
Mm-hmm. Well, if our control room can put up a picture, we have a sample of what a hoarding situation looks like. And does our control room have that? Here we go. Taking a look at this, I mean, mm-hmm. this is certainly not a collection.
Definitely not, I would say so.
Because collectors usually, maybe they'll put things in categories
right.
and they'll log them if you're collecting stamps or coins. Okay, thank you, control room. Yeah. So, but hoarders, it's random. I mean, or do they target specific items?
You know, it really varies by each individual. No two cases are really identical. Mm-hmm. But there are a variety of different reasons and paths that I find hoarders come to their particular practice. For example, some people, it does become like an innocent hobby, mm-hmm. but for various reasons, they become so attached to these items, they become symbolic or sentimental to them. Mm-hmm. And no matter how crowded their house is, there could be no place to sit, there could be no place to sleep, there could be no place to cook. Mm-hmm. They just can't let them go. Mm-hmm. It's almost like they're letting go of a person in their life.
Well, you know, preparing for this show, researching, I watched a few episodes of, I believed it was Buried Alive. I had never even focused on hoarding. And I don't know how those people breathe, never mind live, because things are literally from floor to ceiling, wall to wall. You know, one of the shows, you know, the toilet didn't work, the sink didn't work. Mm-hmm. And I don't understand, like, how people,
someone can let them get to that state.
Yeah, and talk to me a little bit about how they don't let family members in their lives to help them.
Right. Well, one of the other ways that people get involved with this to begin with is that they believe that they are the only ones who can touch or handle any of their belongings. Anyone else is seen as someone who may damage them, who may throw them out, which usually is what family members are attempting to do. But they often, although they're this slide that you showed up a moment ago seems to be just complete chaos, the hoarder usually knows that there's something in a particular pile somewhere, but if it gets moved, they won't be able to find anything. So it's almost like someone who places so much of a desire for organization on their life that it becomes impossible to really do because they've just collected so much.
Well, I was reading that hoarders also place false value on an item. So if I went into a hoarder's home and found a place setting or silverware, flatware, they might tell me, oh yeah, it's from the Queen of England, and it may have been from the Five and Dime.
Right.
Do you see that in your practice?
Definitely. I may use a couple of psychological terms that some people...
Please do.
So, very often when someone has a particular vulnerability or insecurity, rather than face that problem, or if they're not able to resolve it, they tend to project it upon other things, whether it's people or whether it's their possessions and objects. So they can sometimes view, if they are feeling vulnerable for perhaps certain childhood reasons, they will begin to see, their very possessions as being, like I said, like poor victims or children almost, and to throw them away would be like a betrayal or an abandonment of them.
Right. Well, let's talk a little bit about childhood reasons. I mean, can abuse trigger this, or sexual abuse? I mean, do you find in your practice that hoarders have some sort of abuse in their background, sexual or otherwise?
There really is no single childhood background that I could say results in hoarding, except possibly that someone else in their family was a hoarder, and it became a learned form of behavior to some extent.
Right.
Like most things in life, with mental illness, there's always a little bit of nature and a little bit of nurture, a little bit of heredity, and a little bit of learned behaviors. So a child could possibly, it's possible, for example, I had a female client who did in fact, unfortunately, suffer sexual abuse, who was a hoarder, and just the place was completely unlivable for her or her husband. But in a way, the clutter was sort of an insulation for her, a protection for her. She would, for example, also worry about her health, ironically, since she was in such an unhealthy environment. But again, it's an expression of her feeling of vulnerability and a need for protection from the outside.
Well, it's interesting that you say that you had a patient and her husband came with her. Are there ever couple hoarders that come to you, that they enable each other?
Well, it's certainly possible, but generally speaking, it tends to be one or two individuals in the family. Anything's possible, any combination. It could be a parent and a child who do it, a couple that do it. Generally speaking, there seems to be one lead hoarder and the other one who is, miserable and putting up with it.
Right.
So really, it's really the person who's not the hoarder that frequently is enabling the hoarder.
Enabling the hoarder. Now, I understand hoarding affects emotions, thoughts, behavior. Talk a little bit about that. And what are the symptoms of a hoarder, not as extreme as the pictures that we had up? And maybe the control room can throw up a picture again for us, please. That's your lower third. Can we have there we go. So maybe something not as extreme as this, it didn't get here yet. I'm assuming that this is the path one goes down. Thank you, control room. But what are the first symptoms that, I think so-and-so is becoming a hoarder? Right.
Well, certainly, certainly any history of OCD would be, something to begin watching, whether it has to do with hoarding or anything else for that matter. There are many forms of OCD.
Let's talk a little bit about OCD.
Sure.
Yeah.
Well, OCD is an anxiety disorder. And there are literally millions of types of it, not just the typical ones you see on TV, hand washing, putting things in order, checking locks. There are really many, many more that one can't even imagine. And in many cases, the person is obsessed with a particular worry in their mind that makes them, it could be that something bad is going to happen to someone or to themselves. It could be that they feel guilty about something. And then they engage in some kind of a behavior that tries to get rid of that bothersome thought and its associated discomfort. The problem is that it's sort of like telling yourself to not think about a white elephant.
Right.
If you're doing something to get rid of a thought, you're just really reminding yourself more of it. And over time, what happens is however it gets started, the real factor is what the person themselves is doing to add to it.
Right.
So the more the person engages in some of these compulsions, which in the case of a hoarder would be, either collecting or just avoiding throwing things out. The more they do it, the more they're actually actively building their fear larger and larger. So in terms of treatment, the implication is that if we reverse their behavior, their anxiety over these worries will diminish.
So are you treating OCD and as a result curing can hoarding be cured?
Definitely. Hoarding is a type of OCD, and frequently people who are hoarders have other OCD symptoms along any of these other lines. It's extremely treatable. OCD is extremely treatable, as is hoarding. It takes work. But it's not something that's scary like you see on these sensationalistic television shows.
Right.
It's very gradual. You and the therapist talk about, various options, about brainstorm what you feel ready to do, and that's what you do. And then it's sort of like stretching a little more and a little more, just like exercising at a gym.
Do you go into the hoarder's environment when you treat them?
Frequently I do. I will go in and there'll be a particular, usually what I try to do is to find, with the hoarder to find one section of their home that would really add to their quality of life if it were clear. It could be something as simple as a chair,
right.
Clearing a chair, or a table, or their bed. So it's very goal-oriented, and they really, it's tremendous satisfaction to be able to, there's just so much you could get overwhelmed. To focus on a small part of it makes it more manageable.
Now, I read that hoarders mostly, and I don't know if it's true, I read it, and you can tell me, that they keep themselves in a dark environment. Is this true?
Well, I think by default, yes. Basically, it's they live literally in shadows of these piles of debris in their house. I don't know if it's necessarily that they all turn off the lights per se, but that some people are very concerned about their clutter of possessions decaying, and so they'll do anything. They'll keep the lights off. They'll keep the air conditioning run nonstop all year round.
Right.
You name it.
I remember when I was a child, my mother had a friend who was immaculate. I mean, from head to toe, there was never a hair out of her, out of place, and lipstick always on. And my mother told me the first time she went in her house, she said it was like the Collier brothers.
Right.
Yeah, she said she couldn't believe it. So, I mean, is that a characteristic of hoarding? So they put on a persona?
Well, what I would say is that generally speaking, hoarding, OCD, people tend to have some aspect of their life in which they're a bit perfectionistic. So it seems paradoxical that someone who's so put together on the outside would be so, disorderly in private. But when you think about it, what they have in common is that, it's much easier to put yourself together and look and really be very perfect about it. Whereas in the case of their apartment, they have a perfectionistic standard either of what they need to feel comfortable, what they need to feel safe for the future. For example, many people who might be, like the friend you were mentioning, may engage in what we call information hoarding. So, for example, instead of necessarily sentimental objects, they will just collect printed matter, ad nauseum, because, even though they never get to read it, it's possible there may be some important information that they might need at some point in their life. And so again, in this case, it's sort of a perfectionistic desire for information and control and so forth.
Well, I understand that there are hoarders that are in denial. So family and friends will say, Joe, you're really hoarding things. No, I'm not. I'm really not. I know where everything is. I know everything I have, and I'm not hoarding. So that is a symptom of, what is that denial?
People just really lose perspective. We have to keep in mind, this is a mental illness. It doesn't mean the person's crazy in that sense, but it is a mental illness. It's an anxiety disorder that clouds their judgment. And it's like anything else. When something builds up gradually, you really don't notice it. And you sort of become accustomed to it. And with some people, they have some kind of an odd side benefit that somehow makes them feel psychologically safe, perhaps.
Now, I understand that landlords come to you. How do landlords even know what's going on?
Well, hoarding tends to be a very, very private matter. The person often does feel embarrassed about it and frequently does not let anyone into their home. And so eventually what happens is that in apartment buildings, such as in the city, landlords make periodic inspections and so forth. Exterminators come around, they won't let them in. And lately, with all the awareness of hoarding, I think more and more landlords have seen that as definitely a symptom of whether someone might be hoarding. That might be the most clear symptom to go on.
And do neighbors complain? Is that how landlords find out?
Yes, they do complain. It's a risk to everybody's health and hygiene. Ultimately, what ends up happening is, if the person doesn't get help soon enough, is ultimately a crisis happens. Either there's pests, bed bugs, mice, a fire, or just whatever it is, it's something that the inspector cannot get to even inspect because it's completely cluttered.
Now, does it impair their decision-making process, someone living in such a cluttered environment?
Well, first of all, anxiety of any kind impairs our decision-making process and our perceptions and thinking. That would be true whether it's hoarding, OCD, or just having a stressful day. It affects your attention, your memory, your concentration. Those are usually the first things to go. Now, and certainly in terms of their judgment of their own hoarding, that's certainly very distorted.
Is there shame attached? Does the individual, deep down, is there shame attached into the way they're living?
Well, I think that there is definitely for all of them. There are many who are in denial, but I think that even they would agree that it's too much, and that, or at least they realize that it's not normal for them not to have friends or guests over, or for their, spouse or children not to have any place to sleep. So I would agree,
Do you treat the family members that are living with them? Is that part of the treatment?
Most often, the way I get a referral is from a family member or from a landlord. It is much less frequently that the hoarder themselves actually reaches out for help. It's either so embarrassing, or they truly are so attached and fearful of discarding these items that they're afraid to reach out for help. In many cases, if the person is living alone, that's usually the worst situation because there's no one to try to influence them. And they lose all perspective of what seems to be a norm or not.
Are they functional? Do they go out to work? And
it could be anyone. It could be just someone like you or me, Susan, who works, may have a family and so forth. And as you said, no one would ever think.
No one would think,
So frequently, again, many of these people, in fact, are very impressive on the outside and are very organized and effective people in a very controlled type of environment, like an office or where they have to interact with people. Left to their own devices, though, they kind of melt down and become involved, with hoarding.
Can a hoarder separate themselves from? I'm a hoarder at home, but when I go to work, are their desks, do they hoard at work, or you would never know looking at them?
Some do. Obviously, it tends to be the more social scrutiny there is, the less someone tends to hoard. But you can sometimes see a similar kind of thing. You'll see one extreme or the other. Either they will be extremely minimalistic and highly organized at work, such that you would utterly be amazed to learn that they were a hoarder, or you would indeed see some hoarding and sloppiness and stuff at work. That's not to say, of course, that anyone who has a sloppy desk, including myself, is a hoarder.
I understand. But also, there are people that hoard animals also. Is that correct?
There's no end of possibilities for hoarding. It could be anything. Yes, it could be animals. It could be literally anything. And of course, that is the most disturbing and stressful kind of situation for the animals as well as for the people involved.
Absolutely. You see on the news all the time. I think just recently they found a home with 300 cats.
Yes.
It's abuse. It's animal abuse.
Yes.
It really is.
But the person may think that they're actually taking care of them.
Yeah, that they're helping. Absolutely.
Or that they're the only ones who can do it right.
Yeah. Now, hoarding must also interfere with a person's day-to-day activity and sleeping, insomnia.
Absolutely. Every aspect, certainly of their home life, is affected, and that in turn, so sleeping, yes, many hoarders' beds are covered with clutter.
Right.
They kind of dig themselves into their bed each night to find a way to sleep. While trying very hard not to shift their piles of things, because they're afraid that they may not then be able to find something.
The moment they move it, it's lost.
Exactly.
Yeah.
Same thing. Yes, they can't invite guests over. There's no couch space. There's no counter space. There's no sink space. It literally makes it unlivable.
And it must be dangerous. They can trip over things.
It is very dangerous.
It's got to be dangerous.
And again, that is often the way that it's discovered, is that someone sadly, has injured themselves or, God forbid, has passed away.
Yeah.
And the only way it's ever discovered, much like the Collier brothers.
The Collier brothers.
Right, is that way.
Yeah, well, I remember when I was a kid and, I wouldn't clean my room, my mother would say, oh, this is like the Collier brothers, not, of course, never knowing what it was. And then when I got older and found out what the Collier brothers, I was horrified that, shoes under the bed qualified me as the Collier brothers, But,
I hope you could talk your mother out of that.
Exactly, and she got me to clean my room. That's for sure. That's for sure. But let's talk a little bit more about denial.
Yes.
Because I know there are people in the world that are definitely in denial, and it affects everyday living.
Yes.
It doesn't have to be a spouse. It could just be a friend.
Right.
How do we get around denial? How does a loved one, get somebody around denial?
Well, no, this is really the clincher, because it really is primarily through another person that this person is going to get help. That's true of many things, in terms of psychological health, but certainly with hoarding, or other forms of OCD for that matter. And the difficult part about this is that families feel that maybe the person needs more love, or maybe the person needs more understanding. Maybe they can be persuaded. None of that is possible. In fact, that will just make the problem worse.
Oh, I see.
In fact, what it really does require is for the family to be rather a tough love approach.
Like an intervention kind of thing?
An intervention, and also no longer enabling them. For example, someone with OCD or with hoarding, the family, the person gets visibly upset if their stuff is tampered with. So, the family gradually learns to just avoid that. And of course, with children who don't know any better, they just grow up that way. They don't know any other way. And gradually the family retreats further and further and further into just tiny quarters in the home.
Right.
what they really have to live their life as if nobody in their family hoards. They have to take back their rooms, their living rooms, their kitchens, and so forth, as if it really belongs to them and not to the hoarder. And the hoarder is not going to thank them for that. They're going to be very, very upset. But what I will say is this, is that they can no longer be in denial then that this is a problem. And usually that is the only thing that will bring a loved one into therapy. So certainly families, friends should not in any way be deluded into thinking that being kind and gentle is the right approach.
Right.
The harder the tougher they are, the more they're actually helping the person.
But let's say a family member decides to infiltrate the hoarders, and I'm taking back my portion of the bedroom. Does it put them over the brink?
No, it doesn't.
No?
It's only an anxiety condition. They'll scream, they'll yell.
And that's it.
And that's it, basically.
Well, Dr. Brodsky, I can't believe we're getting cued that we're running out of time. We've just scratched the surface. This was, I can't thank you enough for coming to join us tonight.
It's my pleasure, Susan. It's good to have an opportunity with a show like yours to be able to teach the public about this condition and how they can get help.
Yes, I appreciate it. So thank you again. And I'd like to thank you, our audience, for tuning in tonight. If you've missed any of our programs, you can go to my website at www.behindtheshadows.com and click on Public Access Television. If there's a topic that you would like us to discuss, you can contact me at susan@behindtheshadows.com. And until next time, remember, the brightest light shines behind the shadows. Thank you again. It's a great show.
Thank you. It really did surprise me.